This is Dr. Macon Singletary, your friendly North Raleigh periodontist. I am going to talk to you a little bit about today about what's the difference between a periodontist and a general dentist or a specialist in dentistry. In dental school, we all go through different specialties, the pathology, endodontics, orthodontics, periodontics. And we get experience in dental school in these specialties, but not to the degree that we do as we go into a graduate program. Dentists generally will say, hey, I like this and want to specialize in it because I want to learn more about it. What we do in periodontics is go through an extensive program, 2 to 3 years, of studying literature, understanding evidence-based therapy, why we do what we do. And at the end of that program, we take a test where we're certified, and then some of us go on who want to teach, like I did. I went into a master's program, and then I became a diplomate, which is 5 years where you take patients, treat them, document the treatment from beginning to end, and then go through a board and explain why you did what you did based upon literature, not just by the greatest thing that came down the pike, the greatest thing since sliced bread, or some medication that came out that doesn't have any research on it, based upon evidence research. So when somebody comes to our office, we want to try to give them evaluate them. We blend the medical history, oral exam, and x-rays, and the information that I obtained over the years, but also going through the specialty program, understanding how to read literature, understanding how to read research, and understanding that if it's a referee journal, that research is appropriate and accurate, and try to apply it for my patients, that they get treatment that's appropriate for them. Everybody's different. So whether we use implants or laser therapy or root planing, the thought and the treatment recommended is going to be based upon the literature that I have studied in the past, why we do what we do, and in order to help the patient achieve the goals that they want. So not that general dentists can't do that. They can go to specialty programs, or they can go to continuing education courses where they learn a little bit about different specialties and feel more confident treating in their office. But whenever there's a point where extensive therapy needs to be done and laser therapy needs to be done, referring to a periodontist to get a second opinion is a good idea. Or if somebody recommends treatment and you want to make sure that that's going to be appropriate, glad to give second opinions. We get referrals all the time about grafts and recession. Does this need to be done? And based upon the literature and what I see, we can make our recommendations to help you achieve the goals that you want to achieve. Hope this is helpful.